Hello, sisters. We wanted to speak with you this morning about an initiative at Camilla Hall. As you know, the General Administration is in a strategic planning stage. And part of our strategic planning, and a big priority for us, is our work and our mission at Camilla Hall. And we have been working closely with the administration at Camilla Hall and wanted to talk to you today about a new initiative for the administration of Camilla Hall. So I've asked Sister Ann Veronica to explain this initiative to you. Thank you, Sister.
Thank you, Sister Mary Ellen. Sisters, we're so happy to share with you the results of a lot of research that has taken place since we first heard about the Mercy Life program. Mercy Life is a Medicare program. It is a program of all-inclusive care for the elderly, or a PACE program. It would be similar, but a bit different from a Medicare Advantage program or a Medicare HMO. In this respect, Mercy Life is both a health insurance program as well as a health care management program. Mercy Life receives the total allocation of funds for a sister's Medicare or health care coverage, and they manage that health care coverage for the sisters, both in the insurance aspect of it and in the management of the individual care for the sister. Camilla has been studying and exploring this program for the past 10 months. We have done the research by the books. We've also visited other healthcare sites who are using the Mercy Life program. Mercy Life, the life portion of it, stands for Living Independently for the Elders. Mercy Life has been in operation since the late 1990s and has a lot of sites for laypersons in and around the Philadelphia area. But more specifically, Mercy Life has been very successful in working with religious congregations, and we have been in close contact with these religious congregations. The Sisters of St. Francis in Aston at Assisi House, the Sisters of Mercy at Macaulay Convent in Marion have been using this program, some for several years, some just for about the past year. In addition, our own IHM sisters in Scranton are using a life program sponsored by Geisinger Life up in that area. And so we have been in close collaboration with all of these other religious congregations who have deemed the life programs, these PACE programs, as very beneficial for their members. In order to participate, there are eligibility criteria. A participant has to be 55 years of age or older. They have to live in a designated PACE area designated by zip code, and Camilla Hall does live in such a zip code. The residents or the participants need to be capable of living independently in their home, for us, our convent home of Camilla Hall, but still need some assistance. And so the life program offers that assistance to remain independent at home. And finally, the participants need to meet the eligibility criteria in terms of finances. And I know we're familiar with financial eligibility because this is also part of our Medicare D prescription drug programs. As we approach implementing Mercy Life here in Camilla Hall, we estimate that about 65% of our sisters will be eligible for the program according to those criteria, which would mean mostly the sisters on the 3rd and 2nd floors, with the 4th floor sisters retaining their current health insurance through Medicare and through the Hartford group. So approximately 140 sisters would participate in the program. The program provides many healthcare services and many beyond what are already being offered through Medicare. Offered are primary medical and specialist care, nursing care, medications and pharmacy services, speech therapy, occupational therapy, physical therapy, recreation and activity therapy, psychiatry, behavioral health services, podiatry, and some of the services not generally offered through Medicare, such as dental care, vision care, audiology services, and one which we need very much here at Camilla Hall, and that is transportation services, actually taking sisters to and from their medical appointments. Mercy Life uses a network of participating providers, and they will introduce us to their network, but then they will also try to reach out to our existing physicians, surgeons, specialists, and ask them to join with the Mercy Health Network so that we would have as many of our existing providers as possible. Mercy Life personnel at Camilla will serve under the direction of and in collaboration and conjunction with the administrative staff here at Camilla Hall to provide enhanced care coordination. So they will be a supplement to the care providers that are already on staff here at Camilla Hall. Camilla Hall will retain its present staff and request all those not specifically Camilla Hall staff, such as contracted services with Williamson's Food Service, contracted services with Mainline Health, contracted services with Mercy Health, not Life, to stay with us and to continue to serve the residents that they have come to know so well here at Camilla Hall. And it is our hope that all of our present staff and contracted services will remain with us to serve the sisters. The benefits of Mercy Life include a greater array of covered services. As I already mentioned, dental services, vision, audiology, behavioral health, and access to the entire Mercy network of providers. Additional healthcare management personnel will be given to Camilla Hall. About 6 Mercy Life personnel will be added to our existing staff. And another benefit, and a very important benefit, is the financial remuneration for any services that we currently provide for the sisters that Mercy Life will not have to provide because they are already in existence. Most specifically, that will be nursing care and also transportation services. We recognize that there will be some challenges. Some of these are that there be no distinction whatsoever between those sisters who participate in Mercy Life and those who do not participate. A smooth transition when any protocols or routines have to be adjusted, and very importantly, an integration of the personnel with our existing personnel such that Camilla Hall's mission and core values are honored by everyone so that we become one seamless team here at Camilla Hall. There is a contract involved, but there is opportunity at any point in the process for us to make changes in the contract or even to return to our existing health insurance model should that be deemed necessary. However, it is our fervent belief and hope that this is going to be a program that really benefits the sisters of Camilla Hall now and in the future. So we are excited about beginning, and we thank you for your interest and your support of this new program for Camilla Hall. Thank you.
Thank you, Sister Ann. And sisters, I just want to clarify one point that Sister has expressed. And I want to make sure that we all understand this. But Camilla Hall will still be under the present administration. We are very intentional about keeping the IHM administration of Camilla Hall. So Sister Ann, in her role as administrator, will retain the role and the responsibility, and Sister Dolores Joseph, as superior, will retain her role and responsibility. The council has made this decision in conjunction, in coordination with the staff at Camilla Hall, because we see this as augmentation of our already existing program, and we can offer more quality of care. And also, sisters, we are looking to the future so that we can have a sustainable model in an IHM mission at Camilla Hall. So I want to take this opportunity in the name of the congregation to thank Sister Dolores Joseph, Sister Sharon Hedrick, Sister Ann Veronica, and the entire administration and the sisters at Camilla Hall for helping us bring clarity to this decision. Sisters, as we move forward in our strategic planning at Camilla, you can be sure that we will let you know all the steps that we are taking to ensure the utmost care of our sisters. Thank you, sisters. God bless.